The drug overdose crisis is having a devastating impact on families and communities. We see it across Canada and here in Ottawa. It is worsening with the ever unpredictable and toxic drug supply that we have. I want to share with you, of course, you know, all of you here, that the number of fatal and non-fatal overdoses increased during the pandemic. And what we're seeing is it's remaining elevated. So last month, Ottawa hospitals experienced the highest counts of opioid-related emergency department visits since they started counting this in 2017 and reporting on it. People experiencing overdose have many unmet needs, unmet health needs, unmet social needs, and we need to think about how together we advocate to continue to look at all of those gaps, including for housing. It requires many partners working in coordination and connections. And I want to thank and call out many of the people that we're working with as Ottawa Public Health, with community social services on housing and more supports for health and addiction services in housing settings. Working with people with lived and living experience who you are providing leadership every day in so many ways. We're working with the hospitals and the pharmacies and emergency services, police, paramedics, and fire services to change the crisis response and provide that emergency intervention. We're working with the mental health and substance use health and addiction service providers to build that capacity for the services that are needed around mental health, addictions, and substance use. We're going to continue as Ottawa Public Health to advocate for safe spaces for people to be and supportive housing options I mentioned, and also developing that alternative for mental health and substance use crisis response so that people can feel safe when there is an emergency and a crisis, that they'll have the right kind of support people show up.